Ragasore David, together with his colleagues who were part of the mass testing, say they are relieved and glad to know their status and vow to do better in protecting themselves against the virus.
I
have decided to continue protecting myself against the virus by washing my hands with clean water and wearing my face mask properly, as well as avoiding crowded places. My first decision was to play my role through collaboration and adhering, through wearing my face mask properly and avoiding unnecessary movements unless I had to. Public health experts say that the mass testing in conjunction with the lockdown will give a clear picture on the nature of the pandemic. Figures from the mass testing conducted these past 2 days show that the positivity rate is currently at 3.7%. Dr. Vedast Narindwa from the World Health Organization Rwanda says these current figures are promising and they give hope. Having a positive rate of between 3.5 to 3.7% is a big number, yes, but it would be bad news if it were up to 10%. Yes, it's still not good because people are still getting infected, but it gives hope more than I'd suspected. I believe if people continue with respecting the regulations, we can beat this virus and faster. The Ministry of Health says conducting mass testing in different cells in Kigali was necessary to know the nature of the pandemic, and that this will be done again towards the end of the 10-day lockdown, which will inform the next decision.
Okay, at the end of this lockdown, we proceed again with testing, especially in these most affected district and the city of Kigali, so that we can assess the impact of the lockdown. So it's planned as with the same size of sample, 15% of household will test in those households. This is what we plan. We want to assess the impact of the lockdown, and we expect that it will be a good impact in terms of reduction of incidence. Randomize household like we did this round, because you want, if you want to proceed to inform, if you can't make an exhaustive testing for each one, then you should comply with the method for sampling. So we'll randomize again household, but in each village. At the end, it will give us the sense of the size, it will give us the sense of the incidence or the prevalence of this pandemic in those cells and of course sectors.
On the first day of the random mass testing, 50,880 tests were conducted, and on Sunday, 73,608 samples were taken. Among these samples, 4,770 tests were found positive. Overall, 1,887,262 tests have been conducted in Rwanda since March last year. The country has registered 57,322 COVID-19 infections so far, of whom 40,041 have recovered, 72 currently critically ill, and 649 have succumbed to the virus. Gloria Mutesi reporting for RTV News.